Hey everyone, and welcome to our explainer on preparing for the best possible outcome for your spinal surgery. Now, if you're watching this, chances are you or a loved one are gearing up for an upcoming procedure. And let me just say, it's completely normal to feel a bit anxious about it. But today, our goal is to totally transform you from an anxious patient into an empowered, active participant in your own healing. We're going to completely strip away all that dense medical jargon. You definitely won't hear us throwing around complicated terminology today. Instead, we'll use clear, simple terms like nerve pain so that everything makes perfect sense. Because the truth is, the more you understand, the better your recovery is going to be. Okay, let's dive into this. Here is our roadmap for today. Number 1, meet your spine expert. Number 2, physical and mental preparation. 3, setting up your home. 4, nutrition for faster healing. 5, mastering post-surgery movement. And finally, number 6, preventing post-surgery complications. Let's jump right in. Section 1, meet your spine expert. You know, having a definitive, reassuring expert by your side is absolutely the foundational step for any successful surgical outcome. When you're rolling into an operating room, you want to know with total certainty that the person performing your procedure is someone at the absolute top of their field. And that's exactly who Dr. T is. Dr. T actually holds a really unique and highly prestigious dual fellowship. He completed a neurosurgical spine fellowship at Stanford University Medical Center, combined with an orthopedic spine fellowship at the Texas Back Institute. This kind of incredibly rigorous dual disciplinary training means he looks at your spine with a comprehensive level of expertise that really just builds unshakable trust. Simply put, you are in the best possible hands. Section 2, physical and mental preparation. So we need to talk about managing existing health conditions. If you're diabetic, this number is vital, 7.5. Keeping your A1C levels under 7.5 makes surgery significantly safer. Why? Well, high blood sugar can actually increase your risk of cardiovascular complications, infections, and it can severely slow down how your wounds heal. So make sure you work closely with your primary care provider in the weeks leading up to surgery to get this number exactly where it needs to be. Next up, we've got a pretty strict medication stop list. Exactly 2 weeks before your surgery, you absolutely must stop taking aspirin and any blood thinners. You also need to hit pause on all NSAIDs, so that means no Advil, no Aleve, and no ibuprofen. And this one usually surprises people. You also need to stop certain herbal supplements like vitamin E, fish oil, and ginseng. Believe it or not, these can all actually thin your blood and increase bleeding risks during the procedure. We want zero surprises on the day of your surgery, right? But hey, it's not just about your physical body. Your mental preparation is just as vital. Recent studies actually show that psychological prehabilitation, which is basically just proactively managing your mental health and addressing any anxiety before the operation, well, it's been shown to literally shorten your hospital stay. Patients who mentally prepare report way less postoperative pain and much lower rates of depression. A calm mind truly does promote a healing body. Section 3, setting up your home. Now, what's really interesting about prepping your space is that you're going to have some strict movement restrictions when you get back. So you need this crucial adaptive equipment ready and waiting for you before you ever leave for the hospital. First things first, clear out all that clutter and get rid of those pesky throw rugs to prevent any dangerous falls. You'll want to move your daily items, think plates, cups, your toiletries, right up to waist height so you aren't bending down or reaching up high. In the bathroom, a shower chair and long-handled bath aids are an absolute must so you can sit and bathe safely. And finally, do yourself a favor and get a reacher or grabber tool for literally every major room in your house. That way you never have to bend over to pick something up off the floor. Section 4, nutrition for faster healing. Let's talk food. Here's a super simple 4-step surgical diet plan to fuel your body for the physical trauma of surgery and really accelerate your recovery. Step 1, 2 to 4 weeks prior, you want to eat a high-protein, high-carbohydrate diet. Step 2, start adding in daily protein supplements. Step 3, you'll drink a clear carbohydrate drink exactly 3 hours before your surgery. This replaces the energy your body burns while you're asleep. And step 4, keep up with those protein supplements after your surgery. That gives your body the essential building blocks it needs to repair skin and tissue. Section 5, mastering post-surgery movement. Early on in your recovery, you're likely going to be using a mobility aid, something like an upright walker. And mobility aids are fantastic because they redistribute your body weight away from your healing spine. The goal here is definitely not to just stay in bed all day. In fact, getting up and taking frequent, short walks around your house is literally the absolute best medicine. It gets your circulation going, eases up stiffness, and really kickstarts that recovery process. But wait, how do you actually get in and out of bed? Well, you have to master what's called the log roll technique to protect your new spinal fusion. It's actually beautifully simple. First, you sit on the edge of the bed. Second, lower yourself down onto your side while lifting your legs up at the exact same time. Third, you want to keep your core totally engaged and imagine your body moving as one solid piece of wood, like a log. And fourth, gently roll onto your back. The big secret here, absolutely no twisting whatsoever. Now, you're going to need to utilize these safe movement techniques for a little while. Expect to face strict movement precautions for about 6 to 12 weeks. Healing a spine is a marathon, guys. It's not a sprint. Your patience here literally pays off for the rest of your life. During those 6 to 12 weeks, you have to live by the absolute golden rules of spine recovery. We call them the BLT restrictions. And nope, that doesn't stand for the sandwich. It stands for no bending, no lifting, and no twisting. Violating these BLT restrictions can literally undo the surgery and put your fusion at serious risk. So please let your body heal. Let your tools like your grabbers and your shower chair do all the heavy lifting for you. Section 6. Preventing post-surgery complications. I know a lot of patients worry about dangerous blood clots after surgery. So let me just calm your nerves right now. The actual risk of developing a deep vein blood clot after spine surgery is incredibly low. We're talking under 1%. And you keep that risk practically at zero simply by following instructions. Just get up, wear your compression socks, and walk frequently. It really is that straightforward. So, the crucial point is, while blood clots are super rare, constipation is definitely not. Between 40 to 95% of patients will experience constipation after surgery. This is primarily caused by the opioid pain medications you're prescribed to keep you comfortable, combined with, a temporary decrease in your daily physical activity. Because it is just so common, you need to know exactly how to manage it. Yes, you absolutely should use stool softeners and gentle plant-derived laxatives. These often contain an ingredient called senicides. But no, you should absolutely avoid bulk fiber supplements. Here's why. If you take bulk fiber without drinking massive amounts of water, it can actually turn into concrete in your gut and make the whole problem much, much worse. Just stick to the softeners your care team recommends. And honestly, that beautifully illustrates just how much control you truly have over your surgical outcome. By understanding your surgeon, prepping your home, eating right, and knowing exactly how to move, you are setting yourself up for an incredibly successful recovery. If you're ready to take control of your spinal health and want to explore your options, don't wait. Call 602-833-2141 to schedule a consultation with Dr. T at Microspine. You've got the knowledge now, but the real question is, what small step will you take today to guarantee your spine heals stronger than ever?